All right, so today we're digging into something kind of different, death investigations.
Uh-huh.
We've got excerpts from textbooks, some research articles, even a few case studies, all about how investigators, reconstruct events and timelines
Yeah.
just from looking at the scene and, well,
The body.
the body.
Right.
And I know this is right up your alley, but the stuff you sent over, seriously interesting details in there.
It's a fascinating field.
So I'm really curious to get your take on all this, since you practically live at crime scenes.
Happy to be here. I mean, it's true. Every death scene, it's like it tells a story.
Right.
But the key is you got to know what to look for.
Exactly. And speaking of looking, one thing that really stuck out from the material was this emphasis on observation.
Yeah.
It's like being a detective, but in reverse. Absolutely.
Starting with the fact that, someone has died.
Right.
And then working backwards.
Taking the victim as he finds him. That's the saying.
And no assumptions.
None. Pure observation. Evidence. That's all you can trust. And you'd be surprised. Sometimes it's the smallest things.
Oh, I bet.
Ice cubes in a glass.
Really?
The position of a doorknob. Things an untrained eye wouldn't even register.
Yeah. Like that example in the material about the heat register.
Right.
I mean, who would have thought that something like that could actually impact decomposition rates?
It can be huge. Imagine misjudging the time of death because you didn't factor in the room temperature.
Exactly. And speaking of time of death, the body itself is...
Well, the biggest piece of evidence we've got.
Right. Right.
Now, you know about the 4 signs of death, I'm sure. The classics. Rigor mortis, liver mortis.
Algor mortis, decomposition. But here's where it gets really interesting. Did you know that even the color of liver mortis, the blood pooling, can tell us something like cyanide poisoning?
Whoa, really? I have to admit, I kind of skimmed over that part. How so?
Oxygen, or the lack of it. Cyanide basically shuts down the body's ability to use oxygen.
Wow.
So you get this buildup of oxygenated blood, which looks bright red even in liver mortis.
Huh. It's amazing the body really does whisper its secrets.
It does.
Okay, so we've got the when, but what about the why, the cause of death? The material went into all these different types of injuries.
Well, right.
Blunt force, sharp force, gunshot wounds, strangulation.
Each one leaves a different mark. The signature.
Right.
Take a straight laceration. Most people, they'd see that and think knife wound, right?
Yeah, seems logical.
Makes sense, but not always accurate. You see tissue bridging and abraded margins. Points to a blunt object.
So it's not always as simple as it seems.
Never. We can't rely on assumptions. We have to follow the evidence. Just like that point about finding vomit at a scene
Oh, yeah, I remember that.
doesn't automatically mean the person choked.
Right, there could be a whole other reason.
Exactly. Was it a toxin? Some kind of medical condition? Something else entirely? We have to figure out what caused the vomiting in the first place. That's where the real investigation begins.
There's always more to it than meets the eye.
It's like solving a puzzle, finding those connections, figuring out the truth.
And some of those puzzles, they get pretty complex. Like with gunshot wounds, the material talked about how everything from the type of gun to the angle, it all affects how the wound looks.
Yeah, gunshot wounds, they're a whole other ballgame. Entrance wounds, exit wounds, grazes.
Right.
Each one tells a story.
It's like its own science, right?
Absolutely.
Analyzing the powder burns and the stippling and the trajectory.
And the internal injuries, too.
Yeah.
X-rays are critical, not just for finding the bullet, but also for seeing the path it took,
Wow.
which can be, super important for figuring out what happened.
So speaking of figuring things out, restraint asphyxia, that part really got my attention. Especially how hard it can be to be sure, what actually caused the death.
Oh, it's tricky, for sure. You got to consider everything. The position of the body, how much force was used, any medical conditions, even the person's build can play a role. It's rarely straightforward.
It's like those hogtie studies mentioned in the material, right? Restraining someone face down, even with pressure on their back, didn't always cause asphyxiation if they were healthy.
Right.
But what if they had a heart condition? Or the restraint was different, tighter?
Exactly. You can't just see a restraint and assume asphyxiation. You look for signs of a struggle. Check toxicology reports. Consider their health history. You need that whole picture.
Context is key.
Always.
It's like finding medication at the scene. A bottle of Vicodin could mean so many things, right?
Right.
Pain management, an old injury.
Possible overdose.
Exactly. Makes you wonder what investigators would think of your medicine cabinet.
Huh. Right. That's why we can't jump to conclusions. Got to look at everything, consider all the possibilities, and document everything, every photo, every sketch, every single detail.
Because if you miss something.
Could throw off the whole case.
And then there's identifying the victim. Even when it's, a difficult scene, decomposition, trauma. The material talked about all sorts of methods. Visual ID, dental records, DNA.
It's crucial for the families, for the records.
Yeah.
Visual ID is usually the first step, but it's not always reliable. Decomposition, facial trauma. That's when we turn to fingerprints, dental records, DNA. Even a single tooth or a bone fragment can tell us so much.
It's incredible. The body really is like this library of information.
It is, and that brings us to the autopsy. The main event, you could say. Although,
It's more than just finding out how they died.
much more. It's an examination. Analyzing evidence, consulting with other experts.
Piecing together the puzzle.
Exactly.
It's like being a medical detective.
That's a great way to put it. Observing, analyzing, interpreting every little clue.
And just like a good detective, you have to go in with an open mind.
Absolutely. No preconceived notions. Let the evidence lead the way.
It just blows my mind, how something so small, like the way a doorknob is turned or a slight difference in color.
Can make all the difference.
Yeah, it can be the key to the whole thing.
That's what makes this field so amazing. Finding the truth in the most unexpected places.
Makes you think, though. This whole idea of observation, deduction, putting the pieces together, that's not just for crime scenes, is it?
Not at all. These principles, they apply everywhere. Anytime you're dealing with a complex system or trying to understand like what led to what.
We're all kind of like detectives in our own lives, aren't we? Always observing, interpreting, making decisions based on what we see.
And the more we pay attention to the details,
Right.
the better we understand the world around us.
It's like we need to hone those skills, train ourselves to see what others miss.
Think about it. Doctors diagnosing patients, engineers designing a bridge.
Right.
Even just figuring out why your computer's acting up. It all comes down to observation, deduction.
Asking the right questions,
Yeah,
not just accepting things at face value.
which is what this whole deep dive has been about. Really, it's not just about the technical stuff, the procedures.
Right.
It's a way of thinking, being curious, thinking critically.
Absolutely. This has really been eye-opening, not just, the ins and outs of forensic pathology, but just how much observation matters in everything we do.
And that's what I hope people take away from this, that idea,
Right.
to really pay attention.
Ask questions.
Don't underestimate the power of a keen eye.
Well said. So next time you walk into a room, take a second. Really look around. What do you notice? What can you tell from the objects, the overall vibe, the little things people miss? You might be surprised what you discover.
You just might.
And on that note, we'll leave you with this. How can you use this kind of forensic observation in your own life, in your work? What hidden clues are out there just waiting to be uncovered if you know how to look?